And good evening now. We begin tonight with the coronavirus as a Midlands woman who tested positive says she's been left with lifelong heart problems. As Eleanor Tabone explains, she says she's never had a problem with her heart until now.
Didn't even realize it was COVID in the beginning.
Cindy Case is a COVID-19 survivor.
It didn't get better and it progressively got worse.
Mid-August of 2020,
I had just recently moved down here from Michigan.
a move that was supposed to fill her with happiness.
Gosh, I'm sorry, I get emotional. It was a very scary time.
She tested positive to coronavirus. With her medical background,
I've been a nurse for over 40 years.
Cindy says she knew something wasn't right.
I was actually out shopping and I felt terrible. If it wasn't for the shopping cart, I could not have stood up.
She collapsed,
And it felt like my heart was just going to rip right out of my chest. It was pounding so hard.
admitted to hospital,
Because of the heart damage, they thought I was going to have a pacemaker.
and alone.
99% of my family is in Michigan. Yes, we talked on the phone, but it's not the same as having someone there holding your hand or, giving you a hug. They love you.
The 65-year-old feared the worst.
It's scary when you're in the ER and they've got the crash cart parked right there at the foot of your bed.
Her cardiologist,
That's very frightening.
Dr. Ryan Wilson from Prisma Health, says COVID adds another layer of complexity and unknowns for those with heart conditions.
Most of these people do have some pre-existing heart disease that seem to be acutely exacerbated by COVID. However, some of the patients don't have any pre-existing heart disease and still develop problems after they have a COVID infection.
He says while some can brush COVID off in a few days, others cannot.
We have seen patients come in with heart attacks, which are acute blockages within the heart arteries.
As for Cindy,
And I just can't explain in words, am I going to be okay?
6 months later,
Today, I am proud to say that I am able to live by myself now.
her message.
It's not a game. It's not a game.
In Columbia, Eleanor Tabone, News 19 WLTX.
And as part of Heart Awareness Month, Dr. Wilson urging anyone experiencing shortness of breath, chest pains, or other symptoms of a stroke or heart attack to go to the ER immediately or call 911.